This is Green Street, the Environmental Health Show, greenstreetnews.org, Patti and Doug Wood, and our worldwide network of experts here to help you navigate your way through this increasingly toxic world. Welcome back. When most people think about air pollution, they think of smokestacks, hazy days, smog, diesel exhaust, smoke from fires, emissions from factories, and so on. They don't think about the air inside their homes or apartments. But scientists are beginning to understand that indoor air can be even more toxic than the air outside. Cigarette smoke is a major factor, of course, along with chemical air fresheners, scented laundry products, and other products designed to make things smell a certain way. But what about your kitchen stove? Do you cook with a gas range? If so, you might want to pay close attention to our show today, because we'll be talking with a pediatrician about how cooking with gas can fill your home or apartment with chemicals that can contaminate your indoor air and cause serious health problems, especially for kids. That's all coming up on this edition of Green Street, but first, some of the headlines of the week. Patti, what do you got for us this week?
Well, I have two things, but the first one is that a chemical recycling facility, which is a pyrolysis plant, where
plastic recycling.
Plastic recycling, exactly.
Yeah.
Is shut down after environmental violations.
Oh, great.
And this is really underscoring chemical recycling's persistent failures. It's just crazy. And this is the second U.S. chemical recycling facility to actually shut down in the past month.
Wow.
Yeah, that's big. Braven Environmental's plastics pyrolysis facility in Zebulon, North Carolina, has been shut down, and an individual on site stated that he had been hired to empty the building and that the facility had been ordered to close by environmental regulators. Staff at the North Carolina Department of Environmental Quality confirmed that the Braven facility is not currently operating and referred to public records showing that Braven Environmental retains multiple unresolved violations with the agency. According to the U.S. EPA records from 2021 to 2025, Braven generated over 400 tons of hazardous waste.
Yeah, I mean, when they burn the plastic, it leaves a really toxic residue.
Unbelievable.
Way more toxic than...
Dioxins and all kinds of really, really hazardous chemicals.
So they ship it off to somebody else and say, oh, we recycled the plastic.
That's right. Extensive reporting by Carolina Public Press and The Intercept in 2023 documented serious operational problems and hazardous waste management issues at the Zebulon facility, including the accumulation of hundreds of containers of hazardous waste, violations of hazardous waste storage rules, and questions about Braven's ability to safely manage its toxic byproducts.
Not to mention the air quality when you burn that stuff.
The record of violations and contamination challenges directly undercuts the industry that claims that Braven and similar chemical recycling projects offer safe, scalable solution to plastic waste.
It's a myth. It's like clean coal. It ain't going to happen.
Unbelievable. So now we have some quotes. Renee Sharp, NRDC's Director of Plastics and Petrochemical Advocacy, says, quote, "Plastic pyrolysis is an expensive, hazardous, and highly polluting technology that is a form of incineration. It will not help solve our plastics crisis and would only create more harm. The closure of this facility is good news for protecting public health and the environment." And another quote from Judith Enck, who's a president of Beyond Plastics and former EPA regional administrator, says, quote, "While industry lobbyists are still telling Congress, the EPA, and state legislators that so-called chemical recycling will fix the plastic waste problem, the facilities themselves are rapidly shutting down, stalling, or never getting built in the first place. Every one of these failures is another reminder that the real solution is not risky industry false solutions like chemical recycling. It's just making less plastic," end quote.
Can I just point out that if plastic recycling really worked, it would cut down the amount of plastic we need, which is contrary to what the industry wants.
That's right.
So, this whole industry push, we can recycle plastic. You got to wonder how serious they are, because that would ruin their market for new plastic, and that's where they make their money, is new plastic. Recycling doesn't get them anything.
Yeah, but it's all about the money. It's all about the money.
And
no
they
kidding. Want to
kidding.
continue making virgin plastic products because that's their off-ramp.
Yep. All right, interesting. I have a piece from last week that I wanted to get to. Last week, the Supreme Court agreed to protect the Bayer Corporation from liability over the popular weed killer Roundup, dealing a victory to the company as it struggles to resolve thousands of costly lawsuits from people who claim the key ingredient glyphosate caused their cancers. The central issue in the case, filed by Missouri resident John Durnell, is whether states have the right to require pesticide labels to carry warnings, or whether a federal law overrides those state claims. Durnell developed non-Hodgkin's lymphoma after years of using the Roundup product and sued because the label did not indicate the danger. In a 7-2 opinion written by Justice Brett Kavanaugh, the court ruled that the Federal Insecticide, Fungicide, and Rodenticide Act, or FIFRA, expressly preempts state law and absolves the company of any failure to warn consumers about the dangers of the product.
This is insane.
I know.
This is insane.
Bayer argued that a federal law gives the power to approve the label strictly and exclusively to the EPA and not the states. Bayer CEO Bill Anderson said, and I quote, "This litigation has enormous costs for the company and has impacted public trust. This decision brings overdue justice on an issue that should have been clarified much earlier." Yeah, I want to know about justice.
Public trust? They want the public to trust them
And
that they're using safe ingredients in these herbicides?
And what about the people with cancer?
What about all those people with cancer?
This decision means tens of thousands of people who developed cancer after using the product will not be able to claim the company is liable because it failed to warn them of the danger. And let me just point out that EPA registration of a pesticide does not mean the product is safe.
Nope.
And that EPA relies 100% on testing provided by the manufacturer.
That's right. This is the fox guarding the hen house.
Yeah, the manufacturer says, oh, it's safe, and the
Yeah.
EPA says, well, okay, I guess it is.
And this is just one particular pesticide that we're talking about.
I know, but this is a bad one. It's been around.
Because it's so ubiquitous.
Most popular pesticide on the face of the earth.
Well, that's what they use for GMO crops.
I know.
Although the weeds are becoming resistant, so they're going to an even more toxic herbicide.
You can't
2,4-D.
You can't beat nature. I'm sorry.
I know.
Do whatever you want. All right, what else you got?
Oh, my goodness. Okay, so Food and Water Watch has a very important report, which is extensively annotated, about data centers. We're all thinking about this right now.
It's all in the news now.
Yep, it's all about AI. They need it, right?
Yeah, so
data centers turn to PFAS for cooling. Data centers' rapidly expanding land, water, and electricity footprints are fueling growing backlash, with as many as 7 in 10 Americans saying they wouldn't want a data center in their community. In response to this intense public opposition, many data centers have promised technological fixes in the form of novel liquid cooling systems.
Oh boy, here we go.
While liquid cooling systems may reduce but not eliminate data center water use, they often rely on dangerous per- and polyfluoroalkyl substances, or PFAS, which are highly toxic, lab-made chemicals that persist in the environment and harm many systems in the human body. Data centers are poised to increase the use of these forever chemicals, just as some other industries are phasing them out.
Yeah, we're trying to get rid of them.
That's right. The data center industry already relies on PFAS and similar compounds for chip manufacturing and is now turning to the same industry that produced fracking fluids to cool its data centers. In late 2025, the infamous oil field supplier and contractor Halliburton announced a pivot to serving data centers amid slowing global interest in fracking. These linkages between the chemical, fracking, and data center industries are not new. Major chemical manufacturers like Chemours and 3M already supply both the oil and gas industry and data centers. And major oil corporations themselves are getting involved, like ExxonMobil and Shell, which both have released several new chemicals for use as data center cooling liquids. No stranger to toxic chemistries, the oil and gas industry was an early adopter of PFAS. PFAS are a group of over 15,000 lab-made and long-lived compounds introduced by chemical corporations beginning in the 1940s.
Well, you know, they're miracle chemicals, Patty. They do all kinds of miraculous things for manufacturers and for
and they
companies.
never go away. They don't break down in the environment. So the companies manufacturing PFAS long hid evidence of the compound's toxic properties and environmental contamination. These same chemical producers are now rushing to repurpose lubricants and transformer oils for the data center liquid market.
We talked about this last week in that book, Inescapable. Right? About how you can't get away from these chemicals.
President Donald Trump issued an executive order to reduce environmental regulations on data centers and use federal resources to fast-track their permits. And the U.S. Environmental Protection Agency announced plans to just get out of the way of data centers, in part by expediting review of new chemicals used in data center projects. The EPA has even announced plans that would allow oil and gas wastewater to be used for cooling data centers.
Oh
PFAS
God.
accumulates in the body and impedes neurological functions and behaviors, increases the risk of type 2 diabetes, decreases bone health and density. PFAS have also been demonstrated to cause reproductive harm, as well as fetal growth restriction and lower birth weights. Childhood exposure is associated with asthma, the development of hyperthyroidism, and delayed onset puberty. And the EPA has classified 2 PFAS chemicals as likely carcinogens.
2 out of the 15,000. They're
To
really
stop
on top of it, aren't they? Wow.
To stop potentially irreversible contamination of our bodies and the environment, we need a moratorium on data centers.
Holy cow.
I'm going to look really hard for good news for next week.
Please do.
I'm going to look really hard because
is tough.
it's hard to find.
Yeah, I know.
Yeah.
All right. Thanks, Patti.
You're welcome. By now, most people are familiar with the term fracking. It's a process of forcing a mixture of sand, water, and chemicals down into shale formations under extreme pressure to crack the shale open and release tiny bubbles of natural gas that have been trapped there for millions of years. The natural gas that comes up contains a mixture of methane, toxic gases, and water. And after it gets cleaned to remove most of these impurities, it gets sent either to export terminals on the coast to ship overseas, or it goes through more pipelines and into the building where you live, and eventually to the stove where you cook. Your stove is literally the end or the terminus of the natural gas pipeline. Stoves leak gas, and gas also escapes during the cooking process, and that unburned gas contains benzene, which is most widely known as a carcinogen that can cause certain leukemias and lymphomas. Unburned gas also contains toluene and xylenes, which are toxic to the nervous system.
The reason that we know this is thanks in part to our guest today on Green Street. Dr. Kurt Nordgaard is a pediatrician in Minneapolis, as well as a fossil gas and health consultant who's published numerous studies on the air quality resulting from burning fossil gas. Patti and I spoke with Dr. Nordgaard earlier this week, and we started out talking about how the issue of natural gas comes up in the context of his work with children. Here's our interview with Dr. Kurt Nordgaard.
What shows up to me most in practice is when we review potential asthma triggers in the home. And when I was practicing in the Boston area, very clear that there are a lot of things in the home environment that were impacting my patients, children with asthma. And nobody really had any idea that cooking with gas might be related to their child's asthma. But we've known since the 70s there's been an association between cooking with gas and childhood asthma. And so that, I think, was really what struck me, quite considerably, is the data have been around for a long time. We're still learning more, and we need to learn more. But people, pediatricians for sure, and certainly people who are really struggling with their child's asthma didn't understand that this was a potential trigger in the home.
Mm-hmm. So, Curtis, what do you tell the parents of a young child who comes in with asthma and you ask them if they're cooking with gas and it turns out that they are? Then what? Where's the conversation go from there?
So I help parents understand, what does it mean to have a child with asthma and cooking with gas in the home? And I think the easiest way to understand it for a parent is that it's like having another trigger in your home. So other examples would be any kind of smoke or infestation with mouse or cockroach, very strong smelling chemicals. Those things can all be triggers for a child's asthma in the home. So I just give him that context and say, well, this is another thing that can be triggering your child's asthma. And there are things that families can do, and even with the most minimal of resources. And the simplest being, if you can either use appliances that don't burn fuels or open a window for ventilation, assuming that outdoor air is not worse than the indoor air, which is mostly true.
Right.
And I've also had conversations more broadly, like, they're often kind of shocked to hear this, and usually they really don't want to have anything in the home that might be making their child's asthma worse.
Sure.
You know, some conversations about cooking with gas, people say like, well, we have to be sensitive. People from other cultures may feel the cooking with a flame is important for their particular cuisine, which I don't disagree with. But it turns out, anytime I've talked to people, and because I work with, like, the largest population I work with is children who have either first or second generation immigrants.
Okay.
They don't care. If I tell them this, based on the science and my understanding of this as a pediatrician, having that stove in your home can be making your child sicker. That's number one priority for them. It doesn't matter. Like, they're going to find a way to cook.
Sure.
I mean, maybe not every time, but that's generally what I'm seeing. So they want to get rid of their stove. They want to find a way to not have the pollution in the home. Sometimes you find out there's like a properly working ventilation hood that vents to the outdoor air, and you talk to them about using that. Some are interested in swapping the stove, others rent, or there's just it's not financially feasible at the time. So we just explore some of those options and try to come up with some solutions, not just to point out the problem, but actually empower them to make their children healthier.
Sure.
So I think that there's a real problem in medical schools where they do not talk about environmental health, and you're not required to take courses in environmental health. And yet, the World Health Organization, way back at the beginning of this century said, environmentally mediated illness is going to become a major, major problem. And yet we do not have a medical community that knows to ask. You come in with a kid who's asthmatic, they're taking their medication, they're using the inhaler, and they wind up in the emergency room anyway. And does anybody ask, did you put a new carpet in your kid's room? Is there an educational component about these things in the medical world, especially among pediatricians? Yeah,
so this anecdotally, I think, is changing for pulmonologists. So general pediatricians, I don't think so. I think if you're in a very busy primary care practice, you may be, hopefully every time you're asking about triggers in the home, but maybe not, and you're doing the medical management. But I think pediatricians are fairly well attuned to think about the home environment. But again, that's often what we are taught to ask about is exposure to cigarette smoke. And then sometimes maybe you picked up the infestations and maybe even the candles, but no, nobody's educating pediatricians on the impacts of cooking with gas. Pulmonologists, on the other hand, I've seen firsthand. I had a conversation with a pulmonologist maybe almost 10 years ago who at the time expressed some skepticism about the impact of cooking with gas. And then after that, several years later, then she's publishing commentaries on how we need to do more to improve indoor air quality, including reduce emissions from cooking with gas. And in my own practice, the pulmonologist that I work with most closely, no question, she is very thoughtful of the home environment and environmental impacts on asthma. Again, probably allergists and pulmonologists are doing that consistently. And this goes back to what I said earlier. The data have been accumulating since the 70s, and they haven't made their way through the medical world yet.
You mentioned exhaust fans as a mediating force here. Have you done any investigation as to how effective that can be?
Not myself, but people study how frequently people use them, and when you do use them, how effective are they at capturing the pollution. And not only that, but actually the ranges themselves, they're not uniform. So different brands, models, they actually have different airflow, they capture air pollution differently. So if you have a strong enough one and you use it consistently, it might capture enough to prevent really bad spikes in the pollution if you use it consistently.
Mm-hmm. Mm-hmm.
So this has to be more broadly disseminated, this whole idea of gas stoves. I mean, we've heard about it, we've talked about it, we know that it is a very common indoor air quality issue, but it's just not getting the attention that it needs.
Well, I agree, which is part of why I've done research and community science-based work on the topic to try and improve understanding of the problem. Yeah, but it will take time.
Well, that's been 50 years. I mean, if we have studies from the 70s, we're talking 50 years, Curtis. That's a long time.
Well, I see your point. We could stand to make faster progress. That's true. But there are some pretty substantial challenges, of course, as I'm sure you're aware of.
The way we're going to get the word out is not only through programs like ours, but piggybacking with groups that already have, they've got a network of people and they can send out information. I mean, clearly we have a very serious problem here. And I understand not everybody wants to know about it because it's an inconvenient truth, right? We have a gas stove downstairs. We got it not that long ago. We always make sure the exhaust fan is on. But as you point out, the stove leaks gas even when you're not using it.
Even when it's off.
Yeah.
Right. And the other thing I tell people, when we're often going in the home and measuring the air quality impacts of a gas stove, and I tell them, if you vented it perfectly outdoors, then you inside your home, you came up with a good solution. Then you just put all the pollution outside in your neighborhood,
Yeah.
Not that it's like a huge pollution source, but philosophically, that's what you're doing. You're just saying, I'm going to just make sure I'm not affected anymore, and then it's all going to go out.
Somebody else's problem. Yeah.
Right, exactly.
Yeah, I get it.
Yeah.
I think more people would be concerned about this if they knew that there was also an issue of carcinogenic chemicals that are coming out of this, not just for asthmatics that we're doing this work, right? We're talking about all the other chemicals that are found, especially in fracked gas, which is mostly what we're using for our stoves today, right?
Well, I would say the cancer-causing chemicals, it's a relatively understudied aspect of gas stove emissions. So they're very, very subtle, pieces of evidence from a handful of studies over many years. And it's only more recently that we've started to actually collect data on this. So I don't blame them. For medicine, we have to make decisions based on solid evidence. And so for one or two studies to come out, we're still accumulating evidence. But what I would expect is that we should be doing more research on that issue and really trying to understand the source, which is, I think, up to this point, what's been done. Studies looking at gas stoves as a source of cancer-causing chemicals and looking at how people are exposed to them, and then looking at whether there's evidence of a relationship between having those chemicals in the home coming from your stove and risks of cancer. So it's a long scientific process that.
Yeah, I know. But there's a whole lot of research that's already been done on the chemicals themselves, like benzene and toluene and so on, that are coming out of these stoves. So we have that research. So, if we were in another country, say the European Union, they would be applying the precautionary principle at this point and saying when there's an indication of harm, right, based on some scientific evidence out there that, that we should take precautions even without scientific certainty.
Let me phrase the question like this.
Yeah.
The natural gas industry is not going to be happy with research being done that says that their product is harming kids and especially exacerbating asthma symptoms. Do you sense or do you know of any pushback from the natural gas industry about that? Are they having studies coming out and saying, oh, it's really not as much of a problem as you think?
Oh, sure. So you can look up one of the studies I was involved with, the first one to measure chemicals in the gas itself going to people's stoves. That came out a few years ago. And there was a response to that, a rebuttal, and that was from scientists for hire, if I could say that.
Yeah.
I don't know. I'm sure they don't see themselves as that, but it's a research institute or center that is often hired by industry to publish against, these kind of messages or findings.
That may impact their bottom line.
Well, that's effectively what's going on.
Sure.
Yeah. And this we're not the only ones that have had this happen to us. In fact, that permit appeal that Phil Landrigan and I were both a part of, this same organization was hired to defend the gas company. And I'm not talking about, when I say gas company, this is not like a little local utility. That gas company was like one of the biggest pipeline companies in North America. It's a huge company from Canada. So they went to this same company that wrote the rebuttal against the paper we published on gas coming from, the composition of gas in people's stoves. And then there's other, great investigative journalism work looking at what the industry has done over decades. And there's no doubt I mean, it's very clear from those journalistic reporting that the industry wants to use the gas stove as a hook for people to stay connected to natural gas service.
So knowing what you know, are you optimistic about where you see this headed in the next few years?
Well, that's a challenging question because I just focus on what's the next work I can do, what's the next thing I can apply myself to, and whatever I'm doing that I think can make the most difference. Whether it does or not, I have to wait and see. But I do think it makes, the research, the advocacy, the policy work, the communications, over many, many years, there's no doubt the work that myself and the people I've had the great fortune to work with over that, 10 plus years, the work we're all doing is making a difference. And so that part keeps me going. Besides the fact that I just love doing it, it's super interesting work and really rewarding. I meet and work with great people. And yeah, once you've stuck with it for a while, you look back and say, yeah, that made a difference. Is it the difference we need? Probably not. But is it the best that I could do? Maybe. Yeah.
It's just sad for us to see how little we value our children compared to how we value keeping businesses making billions of dollars.
Yeah, well, I guess there are a lot of different ways you could think about that one. Sometimes I think about the power dynamics, and industries are very powerful and do a lot to make sure things work out the way they want them to. And, nobody intends, I think, generally not intending to do the wrong thing. Right. Yeah, but they don't make the right choice for various reasons.
Right.
You could say they're misinformed would be another thing.
Sure.
But that's the thing. Other people would say, well, they're just lazy. They didn't bother to go look up, figure out how to make the right decision. Well, there are a lot of different ways of looking at it. So. And
I'm sure the natural gas people would say, well, Dr. Nordgaard, there's, many things that cause asthma. And you can't tease out the stove and say that it was it was the natural gas that caused this problem, right?
Well, I think you're characterizing that accurately in that's what the industry would say. Or, when we do say, well, these are chemicals we found in gas, even to just state that's very triggering, and they'll come back and say, well, you didn't prove that those made anyone sick. Well, we actually didn't say that. This particular study was just saying these are the chemicals we found. And asthma is multifactorial. There's no question about it. A lot of things play into asthma. But no, we can actually, with properly done studies, you can figure that out. Is the pollution from cooking with gas playing a role or increasing children's risk of asthma? Yeah, you can, and that's been done, and it does. And it's probably the same pollutants inside the home that are causing the problem as the ones outside the home, because for pediatric asthma, we see the same thing. That nitrogen dioxide pollution that's produced in significant quantities from cooking with gas, that's linked to childhood asthma, whether it's coming from your stove or it's outside coming from other sources.
But you're absolutely right to think that the kitchen is kind of the heart of the home. Everybody spends a lot of time in a kitchen, and I don't know.
Well, we do, that's for sure. Is there anything that you wanted to say that we didn't say?
Well, just to make the point, cooking with gas is one of the single largest sources of air pollution in the home for people who don't smoke in the home. And that pollution it's a real health risk. And so you can do something for your health and the climate by swapping out your gas stove to induction or electric.
Dr. Kurt Nordgaard, scientist, pediatrician, and one of the world's leading experts on how gas stoves are impacting our lives. You can learn more about Dr. Nordgaard at our program website, greenstreetnews.org, where you'll also find links to our new YouTube channel with lots of our past shows to share with friends and family. That's going to do it for our show today. Many thanks to Dr. Kurt Nordgaard and all of you who listen to and support this show. Patti and I will be back next week with another edition of Green Street. Thanks for listening.